I wonder if you are aware that even here in Australia, with our modern, accessible health system, young people are continuing to fall through the cracks. I'm sorry to have to tell you this, but there are great concerns that many teenagers are not receiving the care they need because their doctors and other health workers may not have the right experience and training. This is against a background where up to 20% of Australian adolescents have a chronic illness. Over 75% of all deaths in this age group are from preventable causes, and as many as a third of young people are experiencing personal troubles like depression, relationship difficulties and risk behaviours. And yet, despite these alarming facts, in comparison to other age groups, adolescent health has been drastically under-resourced. There are many gaps in our knowledge and understanding, and much that needs to be done to address this problem.
One of the problems adolescents face in presenting to hospitals, presenting to general practitioners, presenting to physicians is lack of time and lack of expertise in considering their needs. We still have adolescents being admitted. A 17-year-old girl was recently admitted in Perth to a ward with a manacled, bare-chested prisoner and 2 warders, and that was thought to be satisfactory.
Earlier I mentioned that over 75% of all adolescent deaths are due to preventable causes. Adolescence is a time when behaviours such as alcohol and tobacco use, other dangerous drugs, poor diet, risk-taking activities such as dangerous driving, unprotected sex, and other things like that are really a great worry. Many of you watching now will be parents who know about these risks and dangers all too well, and you will be familiar too with the difficult challenge of intervening and preventing problems. It is absolutely critical that early intervention and prevention practices are put into place at this time through our families, our schools and our communities. Unfortunately, as doctors, we're the ones who see the results of adolescent health risk behaviours when they hit the emergency room, when things have gotten to crisis point.
There's not a lot we know about how to respond to kids in this time, especially around their mental health issues. And often services don't respond by identifying that they have a real problem at this time. But there are lots of systems and services around them that can respond, and it's our duty to pick up on what's going wrong for kids so that they can be well placed for good positive pathways in their lives.
I think mental health problems with young people are devastating. I think they can be very tough. But they are also not inevitable, and they are not, you're not stuck in a transition in time. So I believe very strongly in hope and in working alongside young people and their families when these situations develop.
One of the most important things to take into consideration with young people is the fact that when they do have a problem, they're most likely to approach a peer as opposed to a health professional or a parent or a teacher. So we really need to be equipping young people with the knowledge and the information and the resources that they need to be able to help and identify people that they notify having problems and to be able to refer them through that process. I don't think that we're training young people enough to help them help other young people.
Importantly, in any program developed for a young person, we've got to try and meet the young person on his or her turf. The program or service must be accessible for them. The treatment that's given must be safe and also, of course, effective and acceptable to the key people in their lives as well, in particular their family.
When I was a bit older and I was at the hospital, my doctors helped me out quite a bit. I joined a chronic illness peer support group called CHIPS, and I met a lot of people who'd been through similar experiences to me. It helped me piece together quite a lot of my illness and how to deal with it and how to cope with it. And instead of focusing on all the negatives all the time, it was a lot more life-focused and a lot more about you as an individual rather than you and your illness as a package kind of thing. I went through the 8-week group with a few amazing kids who really understood me and understood where I was coming from, and I understood them, and we related to each other quite well. And I then went on to do leadership training, and I'm now a peer leader myself.
When I got sent to court for my behaviours and for what happened on the weekends and stuff like that, I was allocated to search for some counselling in alcohol and for my problems and stuff, which I made a promise to the judge that I did. So I did. I went out and looked for counselling. I went to our local health community centre, and I was looking for a bit of alcohol counselling because I didn't like what I was doing, what I was becoming. And I was told that the lady would be back in 3 to 4 weeks because she had appointments in outer towns.
There are many groups in our society that have significant difficulties in accessing services. It's not an even process. Not all young people have the same needs or the same capacity to access services. Some of the groups that I'm talking about that we need to focus on include young people in rural areas. There are very few youth health services in rural areas. Aboriginal young people, especially in the rural areas, miss out all the time. We need to focus on other groups such as teenage parents. Boy, do they need some support to carry out the difficult task of parenting. We need to look at refugee young people. And we need to look at young people who carry the burden of looking after adults, young carers. They miss out very often, and they have significant needs which need to be addressed.
If we're serious about health in this country, the really big issues for the future, and they're related to mental health, overweight, diabetes, cardiovascular disease, then we have to get serious about where those problems start. And most of that really comes to fruition in the adolescent period. In reality, our health systems are stuck pretty much where they've always been. In childhood, with a start to life, and then in adult life with replacing all the bits that go wrong as you age. So people like me, we get a good deal. Where we need to make the investments, younger people, adolescent health, in mental health, in substance abuse, and in overweight and diabetes, we still don't make the investments.
Australia has been described as the lucky country, but sadly that is not true of everyone, and particularly our young people. Did you know that Aboriginal children are 3 times more likely to die before the age of 5 than non-Aboriginal, and that 1 in 4 of our young people will experience mental illness? These quite alarming statistics point to a growing disparity within our own society. Despite the comparative wealth of Australia, we are simply failing our young people.